Remember that dystonia can affect speech. Remember that voice tremor. If you have essential tremor and it causes the voice tremor, can be less responsive to DBS. So there is a role for a speech therapist before and after DBS. Sierra's our programmer that introduced us today. Many of you know her. Sometimes even uses the speech therapist beforehand, before DBS stimulation and after, if there's concerns about programming worsening speech, because you can worsen speech. And a problem with speech is if you worsen speech, you might also be worsening swallowing, and we don't want that. And a couple other things about exercise, which I'm just going to put in a pitch for. I promise you, I'm almost done. Exercise can be neuroprotective. A lot of research going into that. Wouldn't that be a wonderful thing? So what does that mean? That means that, let's say you have Parkinson's, those dopamine nerve cells that are vulnerable to damage and cell death. Exercise may help protect them from future damage. So exercise might put the brakes on your Parkinson's. That's a lot of reason to get out there and move. There's lots of other reasons to get out there and move. And there's a lot of research going on in the area called neuroplasticity. So the old idea that you can't teach an old dog new tricks, that's not true anymore. The brain is plastic. The brain is not set in stone, and it can change and improve even into the older years. And there's research looking at all kinds of exercise activities that improve brain function. There's even been some research showing that as little as 5 to 15 minutes a day of an exercise, or actually this was one exercise, not even a day, just one exercise where they did a study, I think it was 15 minutes, improved the area of activity in the brain in that motor area after just 15 minutes of practice. So my message to you is even a small amount is better than nothing and is going to make a difference. It's better to start somewhere and then worry about whether or not you get that 20 minutes a day. Start somewhere, develop that habit, but be safe and do it under the guidance of a therapist, especially if you have balance problems or other issues. So every little bit helps. I saw that in the table back there, there is an advertisement for yoga therapy, and there are many different ways you can get involved and use it or lose it. A physical therapist might be very helpful. I'm not going to go into nutrition today because it's above and beyond what I have time for, but especially with the weight changes after DBS, it's an important thing to be aware of, and we will have a wellness symposium for those of you that are interested on March 20th, which will cover nutrition, and I think you have a flyer in your packet there that reviews that. And then a few more things, and then I'll be able to wrap up. When people do well with DBS from a movement point of view, and they come to us and they say, I'm not doing well at all, it's usually a couple things. It's usually mood, depression, anxiety, apathy, some other kind of psychosocial stressor. So it's still very important to understand the role of depression or thinking functions even, because your sense of well-being depends on improving more than your movement symptoms. And depression can affect quality of life just as much as the movement problems can. Cognition problems with thinking can affect quality of life just as much as the movement can. And apathy and motivation can be a big problem. You may feel better from a movement point of view, but just have a motivation problem. Some things that will need to be dealt with. That is part of your Parkinson's disease, perhaps. And depression really colors everything that you feel, your perception and how you're doing. A few more things I want to say is this is the website that I am putting together with the Northwest Parkinson's Foundation because I'm very passionate about looking at ourselves holistically to do better with Parkinson's disease. But like I said, we'll be posting some DBS-specific information based on some of the discussions we've had along the planning of this symposium, because I think there's a lot of important information you need to know around DBS as well. And I'm going to skip these last couple of slides. And one other thing I want to mention. One of the single most important factors for health and doing well across all diseases is support. Having someone that you can share your symptoms and concerns with, that you trust, and that is empathic across the board is a factor that contributes to better health with your condition. Doesn't matter if you have brain condition, heart condition, cancer, what have it. So there's many support groups in the area. Take advantage of them. We happen to have one here for DBS. It may not be the right one for you. Find the support group that's right for you. If you don't have one in your area, start one. You only need one other person for support. Find one other person. Maybe you'll get a third. Design it around what your common interests are. So support, so important not to go this alone. In summary, take control of your care, take control of your disease, get the information about DBS, be your own advocate, and make sure that your other providers, therapists, anyone else involved in your care has this information. Don't forget about your general health, know what DBS can do for you, and put together what's important as a treatment plan for you for your general health. Be proactive and do what you can to educate yourself. And I think at that I'm done. And shall I take some questions now, or?
Absolutely. You're almost done.
I am almost done.
Almost. So I noticed you skipped some of the slides relating to stress.
I did.
But can you just, in a small sentence, talk about the impact of stress with and without DBS?
Stress, just like I mentioned, if your symptoms get worse quickly, it's not your disease, it's something else, and I said stress can do it. That includes physiological stress, emotional stress. If you have tremor, you know exactly what I'm talking about, right? I get stressed, I get anxious. It even could be good stress, right? The Seahawks are winning. Your tremor gets worse, right?
I think one of the important things is to know that you have stress. A lot of times we ignore it. Like, I don't watch any adventure movies anymore because they kind of stress me out. Although I must admit I did see Avatar.
And is it as good as they say?
Yes.
Avatar's.
I went in because my kids were going, and I thought, well, this is going to be stressful, I know. And I don't think I'm going. At first I was, but through the movie I got so involved, I was living it vicariously. I was tired afterwards, but it wasn't as bad as I thought. Really a good movie.
Yeah, it was a good tired. So very, very important comment. So the comment was, if you didn't hear, be aware that you have stress.
Yeah.
But we all know we have stress. We know stress is a part of life. But are we really aware of when stress is getting to us? Do we know the symptoms? Do we know how we feel? Tremor sometimes is a great barometer because you get stressed and the tremor picks up. But I want you to think about this. If stress worsens your tremor, that is a very concrete example about how you can't divorce the mind from the brain. Mind-body-spirit connection. There really is something to that. So stress makes the tremor worse. Let's flip that around. That tells us we might be able to put in some strategies to manage stress, manage how we feel with stress. So we can control that. And people use so many different techniques, whether it be meditation, other mindfulness techniques, yoga, breathing, music, relaxation. Our lives have become so stressful now. We need to find ways to tap into the relaxation response because we live lives of chronic stress. Stress is very important, stress control.
Raise your hand if you have questions and I can bring you the microphone.
How are the batteries charged?
How are the batteries charged?
You have to take it out and put it back in again, or just
Do you want to take that as the programmer? Go ahead.
Well, the question was, how are the batteries charged? They're fully charged when they go into your body. And then they have a lifespan, 3 to 5 years, depending on what your settings are. But our Our experts from Medtronic can answer more questions about that, actually.
And actually, over the lunch period, you're going to have a Q&A, ask the programmer and the specifics about how we follow battery longevity and what goes into that. Sierra can answer those questions more fully. There was a question over here.
Does DBS increase your risk of compulsive disorders such as excess gambling, excess eating, and that kind of thing?
The question was, does DBS affect impulsivity control issues?
Yeah.
The answer is we're learning more and more about that. So it depends. There was a study that looked at different DBS stimulation parameters, and on this special test of impulsivity, patients were more impulsive with the DBS. However, there can be so many reasons for that. And where the DBS stimulation is in the brain. So we can actually cause impulsivity with excessive stimulation. The other is the medicines that somebody is on, so what they're predisposed to. So we don't know if it's a simple yes to that answer. But we do know that with a certain amount of programming, if we stimulate the wrong targets in the brain, so we increase it too much and that stimulation spreads too far, we can cause impulsivity problems. And the medicines that we use to treat Parkinson's can cause impulsivity problems. Behind you and then in the front.
I just had two questions relating to a chiropractor. Can you have, if you have the DBS, you obviously don't want to have the neck manipulated, but could you have the lower back manipulated?
Yeah, so I say you stay away from the upper body unless for whatever reason, the battery's low in your body. So the question was chiropractor. Can the chiropractor manipulate the lower part of your body? So again, stay away from the hardware, the battery. Make sure you know if it's in your abdomen, but usually it's up here, so they can still manipulate the bottom part of the spine.
And then my second question was, can you use an inversion table?
Can you use an inversion table?
Not really.
I don't see why not, but there are other issues with an inversion table. What do you think?
I think we need to ask our tech support service.
Okay.
We can save that question for our technical expert.
My bigger concern with the inversion table is whether or not you have what we call autonomic changes like blood pressure fluctuations. So there might be issues outside of DBS for that. And in the front and then...
When you talked about weight gain, you talked about not knowing why exactly, but do you know, is there an average amount of weight gain? And do people, if they still maintain their same calorie intake, are they still effective?